Welcome, everyone. Glad that you could join us today. My name is Michelle Bertrand, and I am a community educator with the Regional Learning Center. Today, we're going to discuss a number of things that you can do as a caregiver to reduce the risk of falls in the home setting and ensure the safety of the person you're caring for. Now, we know that medical conditions can increase the risk of falls, and there isn't much that we can do to change their diagnosis or the challenges of the person that you're caring for, but there are some things that you can do to decrease the chance of a fall at home. Before we get started, I want to ask you a few true-false questions to get a sense of what your beliefs are about falls. First, falling is something normal that happens as you age. Is that true or false? If you limit your activity, you won't fall. Taking medication doesn't increase your risk of a fall. Do you consider that to be true or false? Using a walker or a cane will make you more independent. Stop for a minute and think about these statements. What do you believe about them? I will tell you that all 4 of these statements are false. Falling is not something normal that happens as we age. There are changes that occur as we get older that can increase our risk, but falling is not to be considered a normal part of aging. Limiting your activity will not reduce your risk of falling. Some people think the best way to prevent falls is to stay home and limit their activity. That's not true. Performing physical activities actually helps to keep you strong and independent. And taking medication doesn't increase my risk of falling. Unfortunately, this one is false as well. Taking certain medications may actually increase fall risk. Medication affects people in many different ways, and falls can unfortunately be a result of the side effects. And using a walker or a cane will make me more dependent. So this is absolutely false. Walking aids are actually very important in increasing independence. It can allow many people to maintain or improve their mobility, all right, and reduce their chance of becoming less mobile and less independent over time, or less dependent over time. Let's talk about what a fall is. A fall is an event that results in a person coming to rest inadvertently on the ground, floor, or other lower level with or without injury. A near fall is an event in which a person feels a fall is imminent, but avoids it by compensatory action, such as grabbing an object nearby to help control the fall. Now, addressing a fall, of course, is really important, but keep in mind that investigating a near fall is also important. Near falls can signal or warn us that an individual is at risk of falling and can help to prevent a future fall. So it's important to find out from the individual why they almost fell. What happened? Okay, in this way, we can perhaps take some action. Was it a medication they took? Are their shoes ill-fitted? Are there cords or carpet underfoot? There may be things that we can change or improve that can reduce their risk. A little bit of statistics on falls. So falls are the #1 reason for injury-related death, hospitalization, and emergency department visits for older adults in Canada. Falls among older adults cost $5.6 billion in 2008, and that was nearly 20% of the total cost of injury in Canada. We can see from this infographic that as age increases, so does the risk. If you are over 65, you have a 1 in 3 chance of falling. After age 80, the risk increases to 50%. Looking at falls a little bit closer, 95% of hip fractures were the result of a fall. And 40% of nursing home residents are there because of a fall. And half of the visits to emergency room by a senior was due to an injury sustained in a fall. And the resulting hospitalization ended up being over 3 weeks. Okay, so we can see statistically how important it is to identify fall risk, and try to prevent falls. If you fall once, unfortunately, you are more likely to fall again, particularly if we have not identified those risks and put things in place to prevent another fall. Women are 3 times more likely than men to be hospitalized for a fall-related injury. However, men are more likely to die from a fall-related injury. And this may just be because of the types of activities that men are often engaged in. They might be a little bit more high risk, things such as cleaning out the leaves from the eave troughs or shoveling snow and walking on ice. All right, these may be the reasons why they have more serious falls that tend to be fatal. So it's still important, despite the facts I gave you related to aging and falls, it's still important to remember that falls are not to be considered a normal part of aging. Let's talk a little bit about why falls are important outside of the obvious, right? So the stats I showed you about falls and injury and how sometimes they can even be fatal, those are not the only outcomes that happen when someone falls. Even if a person is not seriously injured during or after a fall, there are other things that can happen as a result of a fall. Some people lose their confidence in their ability to get out and about. They become afraid that they'll fall again, which results in them not going out and doing the things they enjoy. They may become isolated and they'll engage in less physical activity. It's a case of if you don't use it, you lose it. Ask yourself this question. Has loss of confidence, feeling afraid, not wanting to go out, happened to any of you who have experienced a fall yourself, or has it happened after the person you're caring for has had a fall? Think about how the fall and the resulting loss of confidence and the fear affected your life or the life of the person you're caring for. The less someone does, the weaker their muscles become and the poorer their balance become, and this actually increases the risk of falling again. As you can probably guess, okay, these types of changes have an impact on caregivers and their family members as well. If the person who fell becomes less mobile, and less independent, they now require more care and support. And this can increase the time, the effort, and the money even that's required to provide caregiving to the individual. So it often ends up in a type of downward spiral, right? So that's why we say for many reasons, it's important to prevent falls. So to prevent falls, we need to ask ourselves why someone is falling, okay? And why do people fall? Now, this cartoon, it's very clear why this person would have fallen, right? The doctor's asking, are you the one that keeps falling down? That's a pretty straightforward answer. And sometimes it's not quite so easy, okay? But understand that falls typically don't just happen. There are usually some contributing factors to a fall, even though they may not be obvious, okay? And once we identify them, we can often make changes to reduce the risk of the fall happening again. There can be a variety of reasons why people fall, and these reasons for falls are called risk factors. If we look at the pieces of this puzzle, you'll see that many of these causes or risk factors are related to health conditions, vision, dizziness, balance, blood pressure. Okay, the risk factors for falls are numerous, complex, and they are actually interrelated. Okay, so all of those conditions that I mentioned, even leg strength and balance, even depression, can factor into falls. Medication, right? We'll talk about how medication can impact fall risk. Poor nutrition. If we don't have adequate fuel and support for the body, okay, we can lead to weakness and a fall. We know the cost of food is high these days. What healthy foods is the person able to afford? Are they eating enough? Are they limiting how much they eat based on cost? Home safety is a big one. Carpet, clutter, cords, I say, poor lighting, risk-taking, right? This can be as a result of the behaviors or choices an individual may engage in, such as drinking alcohol, skipping medications, or participating in activities that are no longer safe for them anymore based on their physical or cognitive changes. The more risk factors that you have, the more likely a fall becomes. So if someone has no risk factors, the risk of falling is about 8%. If they have 4 risk factors, fall risk increases to 78%. That is why it's so important to know your risk factors and the actions you can take to prevent a fall from happening to you. Some risk factors you can change. For example, you can make changes to your footwear, do things to increase the safety of your home, improve your nutrition. But there are some risk factors that cannot be changed, and these are risk factors that we say are non-modifiable. For example, you cannot change your age, some medical conditions, and necessary medications. Now that we've looked at some of the possible risks, okay, what are some of the things that can be done or changed to prevent a fall? One of the first things we can do is make sure that we're having regular medical checkups and follow-ups based on the schedule and recommendations of our healthcare provider. All right. How often should the person you're caring for be seen to help manage their health conditions? Is there blood work that needs to be done regularly? Right, and followed up on, right? Make sure that's completed and done in the right intervals, right? If new or worsening symptoms occur and you're not sure what the issue is, things like dizziness or weakness, make sure this is investigated as soon as possible. It's really important to detect health problems or health changes early. There's something called the Staying Independent checklist. This is a checklist you can fill out on your own, or if for yourself, or even for the person that you're caring for. So it looks like this, right? And it's essentially used to assess fall risk, right? So this can be done once a year to identify changes that can put someone at risk for falls. So for this checklist, you would go through all of the statements and answer yes or no for each question and add up all the yeses at the end. A score of 4 or more indicates a risk of falling. So as you look at this list and you think about the person you're caring for, how many of these are a yes for them? Think about the score that they might have once they've completed this. Okay. So once the scoring is completed, you can review this with your healthcare provider. Another really important part of reducing fall risk is keeping active with regular physical activity. Now, why are we always encouraging physical activity? I always say there is nothing in our lives that physical activity does not positively impact. Okay, and our body is certainly first and foremost. It helps our bones and our muscles stay healthy and strong. It improves balance, keeps our heart and lungs healthy, reduces the risk of chronic disease such as heart disease and high blood pressure, helps us sleep and increases our energy. Mentally, it has many positive impacts. It can reduce that fear of falling, can improve memory, attention, mood, sense of well-being. And maintaining strength and balance allows for better functional mobility for getting out of bed, a chair, getting in and out of the car, getting dressed, walking, toileting, being active in the community, preparing meals, all of those things that we want to be able to do to maintain our vitality and our independence. Now, I do understand that people will have conditions that may limit their physical activity, sometimes quite a bit. Okay, but whatever they can do, every little bit helps, even if it's chair exercises like in this video. If the person you're caring for is in the early stages of their illness, try to keep them as active as possible for as long as possible. If you're concerned about injuries or they have arthritis or a heart condition, make sure to connect with your healthcare provider first to find out what activities are appropriate for them. I will provide some information regarding falls prevention programs and exercise programs later in the session. Another thing we can do is review medications. So as we age, our health needs change, and we may end up needing to take one or more medication or supplement to maintain our health. It's really important that we know about the medications we're taking and review them regularly with our physician or pharmacist. Think about how many medications the person you're caring for is currently taking. Do they know the reason for the medication that they're on? What are the possible side effects or interactions? Most seniors in Canada are taking at least 5 drugs. As the likelihood of having a medical condition increases with age, like it makes sense, okay, that medical use is going to be more likely as well. More than 40% of Canadians aged 85 and older are taking more than 10 medications. The more medications you take, the greater your risk of falling. Remember that true-false question from the beginning? The type, duration, and dosage of different medications can also increase the risk of falling. Medications for anxiety or sleeping pills, these are ones that help you relax, or improve our mood, are ones that often can impact our fall risk. As we age, some medications and the way they work or the way they're handled by the body can change, and some of these changes can also increase the risk of falling. So we want to be sure that we are properly managing and utilizing our medications, and that can be done by having them reviewed regularly. What would be some things that you want to discuss with your provider, your physician, when you're reviewing your medications? So the first thing would be, what is this medication used for? A lot of people have forgotten why they're on a particular medication, or they don't understand why they're taking it. Will it cause dizziness and or drowsiness as a side effect? Will it cause blurred or double vision? Right? Dizziness, drowsiness, changes in vision, they can all lead to a fall. What should I do if I miss a dose or have side effects? If I miss a dose, is it safe to take 2 doses close together, or should I wait till the next dose is due? What are some possible side effects that could be experienced or that I should be concerned about, and what should I do? Consider any other questions that are specific to the person you're caring for that you might want to know about. Another thing to consider is vision. There are many changes that we can experience as we age and many eye conditions that can develop over time. This is an example of how someone's vision can be impaired when they have cataracts. Okay? This would be quite advanced cataracts. In addition to developing changes or diseases of the eye, our vision just generally changes over time. We become more sensitive to glare. We need more light to see at night. People who are 60 need 10 times more light to see at night than teenagers. It takes longer for our eyes to adjust to sudden light changes, and it becomes harder to judge distance and depth. We need this depth perception when we are doing things like going up and down stairs and curbs, or when there's changes in the ground below us. So that's why it's important to have your vision checked yearly for conditions such as cataracts, macular degeneration, retinopathy, which is changes in the vessels of the eye, which can often happen in people with diabetes. Right? We also want to make sure that if we have eyeglass prescriptions, they're getting properly adjusted as our eyes change. People with multifocals, bifocals, where we have a number of different fields within the lenses, okay, it can be difficult to have clear vision depending on where you're looking. So be careful on stairs and curbs. You may need to tip your head slightly, or to look out of the top, okay, to be able to see better while you're walking. And remember to make sure that glasses are cleaned frequently. Believe it or not, issues with hearing can also lead to falls, which is not something we might think about. It's important to have your hearing checked as well regularly and to wear any hearing aids that have been deemed necessary to help you hear if you need them, right? Hearing can impact falls just due to the cognitive changes or the cognitive load that is placed on someone to be able to hear properly. Okay. People who have hearing loss may need to use more of their mental resources to hear and interpret speech and other sounds, which leaves less mental energy or less cognitive resources for them to focus on their gait or their balance. Okay. Gait and balance are things that people take for granted, but they are actually very cognitively demanding. Right. So if hearing loss is imposing an additional load for them, right, they don't have much left in their cognitive resources to maintain their balance and gait. People with hearing loss, can also have less awareness, okay, of the things that are going on around them or beside them or behind them. Okay. And it will be easier for them to perhaps not notice a small pet that comes in the room and they may trip on that. Right. So there's impact with hearing loss, okay, when it comes to falls. People with hearing loss can be up to 3 times more at risk of falling. Right? So make sure that hearing is checked regularly. And if somebody is needing to use hearing aids, all right, that they are using them. Because we do know that people can be resistant to wearing things like hearing aids. They feel it makes them look old or handicapped. And again, it's one of those things that is not meant to make you look old or handicapped or dependent. It's actually meant to increase independence. Another time that falls can happen is when we're rushing to the washroom or the bathroom. If the person you're caring for has episodes of incontinence that isn't causing them to run to the washroom, particularly if they have issues with mobility, a fall is more likely to happen. So consider a referral to a continence program to discuss ways to manage this if you haven't already. One example here in the Mississauga region is Trillium Health Partners. So they have a regional continence program that can provide consultation and treatment for management options. A referral is required if you're living in that region and would like to take advantage of that. It can be from your physician or from home and community care support services, or what we know formally as the LHIN. Okay, you don't need a referral to contact the LHIN. If you get in contact with them, they should be able to help you. If you are outside of the Mississauga-Halton area, you can contact your local home and community support services branch, and they may be able to assist you from there with continence programs that are in your area. Okay, this one particular program used to be run through the hospital, but now they actually do home visits, so they will come to you. Another consideration for falls is the use of a walking aid. Ask yourself the following questions. Is your care receiver holding onto furniture or walls for support? Are they having trouble stepping up to a curb? Are there concerns about balance? Is there any leg pain that is affecting walking? If the answer to one or more of these questions is yes, it may be time to consider the use of a walking aid to help mobility. There are a lot of benefits to walking or gait aids, as they can be called, and this includes canes, walkers, wheelchairs, or scooters. They can be used to increase mobility and stability. They can increase safety, reduce fall risk. They can improve and enhance endurance. So someone who perhaps can walk for a short period of time if they're going out, if we give them a walker to help support them, right, they can now probably stay out longer because the workload is now reduced for them. It can reduce pain by taking weight off a painful joint, such as a hip or a knee. It can reduce a limp, right, and make for smoother step patterns that can reduce strain on other joints. We recommend a physiotherapist assessment to make sure that you have the right aid that fits and can be taught how to best use it. There are many different walkers and canes. The designs can be different. And we want to make sure that that person gets the right gait aid and walking aid that's suitable for their capabilities and their challenges. Thinking back to those puzzle pieces, okay, one of them was footwear, if you remember. So this is an example of a well-fitting supportive shoe. Okay, so the back of the shoe covers the heel. All right, I know a lot of people prefer to be able to slip their foot into a shoe, but those can actually increase fall risk. So we want a closed-in shoe, right, that comfortably protects the whole foot and prevents slipping. Here we have a heel that's not too high, okay, but we want a nice, good, firm, supportive sole that's flexible enough to walk, but protects the bottom of the feet. Okay, good, wide, deep toe box, okay, along with laces or Velcro, can help for feet that tend to get swollen at times. We often have people who struggle with edema based on their health condition. So if we've got a little bit of space in that toe area, plus the ability to adjust the shoe using laces or Velcro, okay, we can adjust the shoe for those periods. A really good shoe like this is going to allow for stability, increase comfort, reduce pain, protect the foot, particularly the sole of the foot. We know people may have nerve damage in the feet, right? So if they have any injuries on the bottom of their feet or they step on something, they may not feel it. So a nice, good, thick, protective sole is important. It increases shock absorption and support for all the lower body joints, reduce slipping as well, right? And when we think about a shoe for going outside, these are the types of things that we'd want to certainly think about, the characteristics of the shoe, but also a home slipper, we'd want to have it similar. Okay, we want it to have similar features as the shoe. We don't want people walking in stocking feet. That's often a big risk of fall, really, for anyone, but particularly if you've got mobility issues or any other health challenges. So think about a really well-fitted, closed-in slipper to wear in the home as well. Okay. When we look at these photos, what do we notice that can increase fall risk, right? So wearing inappropriate shoes, multitasking, not paying attention, okay? These are things that are going to increase falls as well. So when we think about the gentleman on the right, when we're walking in the winter, we're lucky we don't have much snow right now, right? But when that snow falls, we want to make sure we're using the right footwear. Okay, what he's wearing is definitely not appropriate. Also thinking about clearing ice and snow and big snow banks, these all become barriers to getting out and about safely. So we want to make sure that those hazards are removed. Thinking about around the house, it can be challenging if you've got health conditions or health concerns to be able to clear your walkway and your stairs and your driveway. So think about a snow removal program if you need assistance with that. Sometimes there's community boards online for people in your local area are offering snow removal for quite an economical price. The town of Oakville and city of Mississauga do offer help with removing that large bank of snow that comes at the bottom of the driveway that can be very difficult to remove. It's called a windrow after the plow goes by. It runs from December 1st to March 31st, and anyone who is a senior or has medical or physical disabilities that does not have an able-bodied person 65 years or less living with them can access that program. There is a cost. In Oakville, it's $115. Mississauga, it's a little bit more, but you might be eligible to access it for free if you meet certain criteria. So those are some resources for you. Ice and snow are really big risk factors for serious falls, as I said, for anyone. So having some help or accessing a service to help remove some of the snow and ice around the home is really important. Also, using ice melt, sand, or kitty litter on surfaces can help with traction as well. Inside the home, these are some of the hazards that we might live with that we don't realize are a risk. So cords or wires that are running in frequently accessed or high traffic areas, clutter, right? Having a lot of things around the home that are just in the way of our walk space. Carpets and rugs, are they slippery on the bottom? Are they curled up on the edges where someone can trip on them? Lighting, do we have the right bulbs inserted in our light sockets? Is the lighting bright enough or is it dim? Stairs and steps and proper handrails. Over time, handrails can become loose, or there can be necessary repairs that need to be applied to stairs and steps in older homes. Okay, those can be fall risks as well. So you can use a home safety checklist to help review your hazards. All right, and go through and take a look at these elements in your home and many others that are on the checklist to see, are they in good repair or are there some changes that can be made to improve them? This is one example of one room that can be altered or made to be safer for someone that's having some mobility changes or challenges based on their health. So in here, there's a number of safety rails that have been attached around in and around the tub. There's a bath chair. The height of the toilet could be adjusted. Sometimes a higher toilet helps people after they've sat on the toilet, makes it easier for them to get up. Sometimes when the toilet's too low, they struggle to get up and then they fall. You can also adjust the height of the sink if possible. So these are some changes within one room, just the bathroom, that could be used or addressed to help somebody remain safe and ultimately help to improve their independence when they're looking after themselves. Some other general tips for preventing falls around the home. Okay, so make sure that regularly used items are within reach. If someone's using their glasses frequently, they use the remote frequently, they have a walker or a cane that they need to help them get up and or mobilize, make sure they're nearby. The phone, for many reasons, is a really important thing. Either it's a cordless phone or a cell phone nearby to someone. If in case they have a fall, they'll be able to get a hold of someone, particularly if they live alone. Taking our time and staying focused. We're often multitasking. Life is moving so quickly. But when we rush, we have a higher risk of losing our balance or tripping. So make sure we're leaving time to do the things we need to get done and take a break. Being tired as well can also increase our fall risk. Have you ever stood up and felt dizzy? As we stand, our blood pressure needs a chance to adjust as we change our positioning. So you can often feel really dizzy when you stand too quickly. Okay? And if you have a health condition or you're a little bit older, that can be more likely to happen. So making sure that we're moving slowly or taking our time when we're walking or getting up to avoid those dizzy spells and budgeting enough time for the things we need to do. Being prepared is always half the battle. So have a plan in place if the person you're caring for is spending periods of time alone. What will you do or what will they do if they have a fall when they're on their own? So some things that you could do to be prepared for a fall include having a personal alarm. This may incur some cost. There are many companies you've probably seen on TV where the person can wear a signaling system around their neck and they can press a button if they've fallen and it can alert help for them. Sometimes people will opt for a daily check-in. So that person may receive a call when they're on their own every day at a certain time, And if they don't answer, we'll alert that person who's calling that there could be a problem and the person needs to be checked on. If you live in a condo or an apartment unit where there's others around you, wearing or carrying a whistle could be something that you utilize to get someone's attention should you fall when you're alone. Someone may be able to hear the whistle being blown and come to your assistance. So you may need to get a little bit creative based on what resources are available to you and to your care receiver as a family to see how can we prepare if mom or sister or whoever you're caring for falls when they're alone. We talked a lot about risk factors, eliminating risk factors after we've identified them or minimizing those risk factors as much as possible, but sometimes a fall will still take place. So what are our options should a fall occur in the home? Naturally, if the person falls and is seriously injured, it's unconscious, we see blood, they've hit their head, they're unresponsive, we're going to call 911. However, it can happen that the person has taken a fall and they're actually not seriously injured, but based on maybe some pain they're having, based on their physical limitations and their health conditions, they cannot get up on their own. It may also be impossible for you, even if you're there to help, to get them up because they cannot help you get them up. They may be too heavy, or you may have physical limitations of your own. If you attempt this and neither of you are really capable, you may both end up injured. So the right option here is also to call 911. The 911 operator will be able to listen to what has happened and do what we call triage the situation, and the EMS will come. It may be a bit of a wait if it's not an emergency situation, as the person you're caring for was not seriously injured, but they will come to provide assistance with getting them safely up, and they may do some assessment as well to see if there's any treatment that they might be able to provide, or if in fact a visit to the emergency room is appropriate. So keep in mind that just because someone is still conscious and speaking and don't seem seriously injured, but you cannot get them up yourself safely and they cannot help you to get them up, 911 is still where you're going to call. If the person that you're caring for is alone and they should fall, all right, these are some steps that they can take to try to get themselves up on their own if they're not seriously injured, but they do have some mobility and strength limitations. If they can call out for help, if someone's nearby that may hear, that's always an option. This is why I said to have that phone nearby, so then they can always easily call. They can slide themselves, to a phone that's close by and call to someone. That's an easy fix, and they'll be able to wait for help. If the phone's not nearby, and again, they live in a unit where there's people underneath or nearby, maybe they could bang, with a cane or some other object to attract attention. Once someone says they're coming, you'd encourage the person to wait in the most comfortable position that they can. If they're having some pain and it's more comfortable to lie on the left or the right, just have them do that. Okay, and just wait for EMS or a family member, whoever they've been able to get in contact with, to come. If you are there yourself as a caregiver and the person you're caring for has fallen and it's not serious, okay, please assess the situation first to make sure that they are not seriously injured, okay? And if that is the case, there is a way that you can help them help themselves to get up. And it's really important, as I say, help them help themselves, because again, if they cannot help you to help them get up, calling 911 is probably going to be the safer bet. They must have some capability to maneuver themselves and get up. All right. So have them lay on their side, bring a chair nearby, and help them through the steps of using the chair as well as your light support to get them up. Okay, so those are some of the steps that can be used for that. Really important to understand that, one, they're not seriously injured, and two, they have some capability to get themselves up and weight bear, through that process of getting up off the floor. Otherwise, you're both going to get injured. I can't stress that enough. I have a few falls prevention programs that I'd like to share with everyone. And this is the focus, we always say, an ounce of prevention is worth a pound of cure, right? So if we can stay active and stay independent, along with identifying those risk factors and modifying those risk factors that we can, right, that fall hopefully is much less likely to happen. Credit Valley Hospital Strong and Steady program. Again, this is something in the region where we are, Mississauga, Halton. This is a 2-hour education and exercise session twice a week for 6 weeks, okay, that people can engage in. Physician referral is required for this one. So if you're in that region, reach out to your family physician and let them know, and they can see what's involved in getting you signed up for that program. The VON exercise and falls prevention classes. So these are for seniors or adults living with a disability. And these are great. The classes can be attended in the community. They offer them in retirement homes and even virtually. So if you've got space at home and that's easier, super, you can sign up, and they will provide that to you online. This is an option for those of you outside the GTA. Just find your local VON program, Victoria Order of Nurses, and see what scheduling they've got available. Okay. Some locations may also offer an education component, some classes that will go through falls and how to reduce fall risk. And free, no cost, and no physician referral required, right? So much more easily accessible. LifeMark Seniors Wellness is another excellent program that provides free exercise programs for seniors as well as falls prevention. Right? So they've got bone health, they've got certain levels of exercises where you want something more advanced, or even something more gentle. They've got a couple of seated programs, a seated Tai Chi, seated dance, seated yoga, right? And those are free as well. Some final thoughts to leave you with regards to falls. Really important to know that even though many of the things and stats and information I shared with you really shows that as we age, the fall risk is more likely, it is not normal. Okay, so please don't normalize falls as something that has to happen, or is not a big deal because we can expect it as we age. Okay, that is not true. Falls are actually preventable. And if we identify those modifiable risk factors, okay, we can certainly make sure that someone stays as falls free as possible. So identify those risk factors, make a plan, particularly if that person you're caring for is spending time alone for long periods. And remember, falls and figuring out why someone has fallen is really important, but so is figuring out why they're having near falls. All right, if we identify the reason for a fall, yes, we can certainly look at why that happened and try to make some changes so it doesn't happen again. But better yet, if someone's having near falls, we can look at that as well and see what changes we can put in place there. So hopefully they don't have a fall at all, right? So remember to report falls and near falls to your healthcare provider. I hope this information helps to increase your ability and your confidence in reducing risk of falls and how to manage them should one occur in the unfortunate event. All right. We hope to see you at future sessions with the Regional Learning Center. Please do continue to check our website and sign up. We always have new offerings coming coming out from month to month, and we really enjoy being able to support caregivers in their important work. Thank you, everyone, and thanks for joining in today.